Welcome to The Whole Pack, where we challenge black and white thinking in holistic pet care and dive into the controversial topics everyone's thinking about but nobody's saying out loud. I'm Sunny Gandara.
And I'm Melissa Sherman, and we are two holistic pet health practitioners here to prove that holistic care can include critical thinking, self-care, and yes, even Western medicine when needed. This is a judgment-free community we wish we'd had when we started our journey.
Welcome back to episode 4 of The Whole Pack, and today's title is Holistic Isn't Holy. What do we mean about that? We're going to talk about something that might make people on both sides a little uncomfortable. But before we do that, Melissa, why don't you give us the Webster Dictionary definition of what holistic is?
Of course, and not to get too textbook on everybody, but I think it's a really good starting place because within the holistic community, I think sometimes we lose track of what holistic truly means. So, the Merriam Webster definition is relating to or concerned with complete systems rather than with individual parts, concerned with the whole person, animal, or organism, as opposed to a specific part or aspect. So, what do you think of that, Sunny?
Well, it definitely speaks to what we're talking about all the time, right? That it's if you have a dog with liver disease, it's not just the liver. Everything is connected. All the organs are connected, and we talk about the gut-brain axis, all of these things. So that is correct, right? But then it doesn't really talk about how do we get to the root cause, or how do we fix something that may be like an acute situation. And so there's a lot of gray area, and there are a lot of different camps and a lot of different opinions about what holistic means, both on the good and the bad side, right? So what is like, let's start with the holistic, our community. What are some extreme sort of opinions you might have heard, Melissa, that might be?
Well, I think, when I first was learning what holistic meant, earlier on, I did think I thought it meant natural. I thought there was this implied natural remedies. You're using natural things to help the body. Um, but really, it's not mentioned in there, right? You're looking at the whole mind, body, spirit. So you're looking at the entire organism to get to what might be out of balance. I think we see a lot in our community. There's this everything has to be 100% natural, zero synthetics, zero additives. Now, of course, you want to try to get things as natural as possible. They're more bioavailable for the body. But if there's a case where they've had a chronic condition for a really long time and there might be an issue absorbing vitamins or eating certain foods because there's sensitivities, having synthetic vitamins in their added to their meals could help them get over that hump. So it doesn't mean it has to be like that forever, but for that individual, that might be what they need to actually start absorbing those vitamins. How about you, Sunny?
Yeah, so like like you said, there is differences of opinions, but when it comes to holistic for us, most of what I see, at least in my practice, are chronic conditions, right? Dogs with inflammatory skin issues, chronic digestive problems, allergies, early kidney disease, metabolic issues, things like that. Those are lifestyle diseases, right? And they do need holistic approaches, as you were mentioning: nutrition, herbal support, addressing root causes. But sometimes, not often, there might be like an acute crisis, right, that needs something quick, like a conventional intervention, if you will. And I've seen some of those extremists, if I shouldn't like call them out, but like that refuse those interventions on principle, right? So it actually costs the animal. And then, we kind of wanted to bring this episode forth because we want to talk more about a balanced approach. I think it's about using the right tool for the right situation. So that means not reaching for pharmaceuticals immediately when a small, like maybe chronic or lifestyle issue pops up, or when a dog really needs better food, lifestyle changes, things like that, but also not refusing pharmaceuticals if there's like the dog is in major pain, or when there's a genuine acute crisis, right?
Right. Right. So if we talk a little bit about Western medicine, which is, that's what the most of us are used to here in the States. And I it treats the symptoms, right? We're looking at just the symptoms. What symptoms is that individual animal presenting with? And what can we do to stop those symptoms? So if it's, for example, if it's like, they're chewing on their paws, they have it what presents like allergies, then we're giving something to stop them chewing on their paws. But what caused them to chew on their paws in the first place? That's where holistic comes into play, right? Because then we're not just looking at, oh, this is the symptom. We're looking at the entire lifestyle of that animal and diet. What are they doing? Where do they play? Do you have carpet in your home? Do you have hard floors in your home? What kind of cleaning supplies are you using? So you're really looking at everything, where with the conventional or Western medicine, it's okay, they have diarrhea, so we're just going to treat diarrhea.
Mm,
End of
mm.
story. And then it comes back, and then a chronic condition there might be an underlying chronic condition already, but think of this going on for months and months. And every time you go to the vet, they're just giving you an antibiotic, an anti-diarrhea, maybe an appetite stimulant because maybe they're a little nauseous. They've had diarrhea for so long. So you're not really getting to what that cause is. So
Mm-hmm.
to me, it's almost like, once I learned what a holistic approach was, it's really hard not to think like that for everything in everything I do in my life, instead of just I see a problem and I want to, address that problem. I'm actually seeing the whole picture of everything. It's really changed my view of a lot of things, but it's hard to get past that when you do go to a conventional veterinarian
Yeah.
and they're not asking questions. They're just kind of like, well, itchy paws, here you
Yeah.
go.
Right? Yeah, it is an eye opener, right? When you know a little bit more, and we might be those annoying patients that come in, right, asking a lot of questions and
Lots of questions.
making their job harder. But yeah, to your point, I just recently had a dog with like chronic ear infections, like constant infections, and that's a huge common thing. I mean, ear infections are really difficult to get rid of. They're the last to go, so to speak. And the vet just kept prescribing antibiotics and eardrops. And of course, they worked temporarily, but then it would come back and even stronger. And so when I looked at the dog's diet, it was like chicken based kibble. So it's
Yeah,
like, and chicken's also a warming protein, right? And this dog already had a hot, damp condition, a constitution. So when we switched him over to cooling proteins like duck, and we eliminated there was grains and added some other supplements, a little probiotics, and all of a sudden, guess what? The infections started coming back less and less frequent, less and less extreme, and eventually, actually, now I think they're fine. So, but that is it's a long approach, right? And sometimes we deal with clients who are very they're very impatient, right? I want it to work now, and that is a challenge. But when there is an infection, though, yes, of course, you do need to stop it. And sometimes antibiotics are valid to use, because you don't want it to spread and make it worse. But as my TCBM trainer and teacher mentioned, is that she is a very holistic veterinarian, but she's not against using Western herbs to treat the immediate crises, right? So get it under control if there's a raging infection or inflammation. But at the same time, we're giving those herbs so that we can support the body, we can support the immune system. And then once that immediate acute, situation is gone, then we start to really treat the body to get the immune system back into balance, right? So that's what, for me, holistic means. It's using all the tools we have available, and at the very, bottom line is thinking about the animal that we're trying to help, right? To
right.
make them not suffer, to make them not be in pain, but at the same time look out for the root cause and helping them long term.
Agreed. And I think something that conventional or Western medicine has done with treating symptoms. So if we switch into the human world, because they don't do this with pharmaceuticals for animals, but if you think of a commercial that comes up with all those side effects on there, so you're putting one thing, you're treating one symptom, but it's creating all these other symptoms. Um, I think that has put a lot of fear in people to actually use Western medicine at all because they know we're not getting to the root. We're doing a quick fix, but it's creating all these problems, and sometimes those problems are pretty severe in animals. You know that warning isn't necessarily given to pet guardians up front, right? Like we're not privy to all of that unless we're looking on the websites and trying to research it. It's a little different in the human world versus the animal world.
Mhm.
But that fear has made it so we see people that no matter what, they never want to touch anything conventional. I'm going to give an example of a client who had a dog with hyperthyroidism, and he's not producing any of the thyroid hormone at all. Nothing. There is nothing natural that you can give that is going to bring that level back up. So this is a chronic condition, right? This is something that as holistic practitioners we would see and be able to help. But when it gets to a certain point, pharmaceuticals are necessary to keep that dog. The dog had lost all of his hair. He was really itchy. He had different endocrine disorders because of this. So introducing that pharmaceutical then brought his levels up. The pet guardian is monitoring those levels with the veterinarian and keeping him on a minimum amount while also, we're giving different supplements. We address the diet and supporting in that way too. So sometimes it's critical for the comfort, but not just the comfort. I mean, I don't know how long the dog would have lasted without
Mhm.
that medical intervention.
Yeah, absolutely. And to your point, I think I shared in a different episode, but about my own dog Tofu, who had MRSP, which is an antibiotic resistant staph in her paws, right? So that's not something I can treat with diet alone. I needed those topical antibiotics that work on resistant bacteria. There was only like one antibiotic I could use, which in itself is scary because what happens when you overprescribe antibiotics for everything is you become resistant, and then what do I do if there's an infection and nothing works, right? So that's a very scary thing. But my point is, while I'm using these topical antibiotics, I also use the TCBM herbs and B propolis to support her immune response and address the underlying pattern that made her susceptible, right? So together, I guess, is what we're trying to say, like that can work, and we can't just do one or the other. Sometimes we just need the symphony of both. But I did want to, we had a discussion off camera and off the microphone, so to speak, about the correct use of pharmaceuticals, right? So you had a very good point about the long time use versus short time use. Like, how are these drugs maybe used in the wrong way sometimes, and very often, actually?
So I'll use NSAIDs as a example because I keep them. I have extra large breed dogs. My dog Balder, he has some hip issues, and he's on a raw diet. He gets a lot of stuff for his joints. He's great. Sometimes he's not. Sometimes he overdoes it a little bit, and I can see a little bit of a limp coming, and that's when I'll grab for something else. So a lot of people are hesitant to use this because it's going to affect the kidneys and the liver. That is long-term use versus short-term use. So if you're using it as needed, or short-term, if you have a dental surgery and they're in pain for a few days and you're using that, those risks are for long-term use. Now, sometimes these medications are not being used properly, and they are being used long-term, where they really should be helping the animal get over that hump, and something else should be used long term, right? Because of course, they can damage the kidneys and liver. So to prevent that is we need to be using those medications properly and not be using them long term.
Yes, I 100%. And that is such a valid discussion to have. And what frustrates me about the conventional approach to chronic disease is the reliance on, as we've talked about, managing symptoms instead of investigating causes. So very common. I'm sure you've seen them in your practice. A dog with allergies. Here's Apoquel for life. When it says, even in the insert, it's not to be used for long term, right? A dog has digestive issues. Here's a prescription diet. But nobody's asking why. Like, why is this dog's immune system overreacting? So why is their gut not functioning properly? And those questions most often will lead to nutrition, where we're helping, right? So they lead to nutrition, lifestyle, environmental factors, all things that holistic practices look at. And as we mentioned before, conventional medicine is excellent at acute care, but chronic disease is where it falls short. So we can rely on each camp for the right situation. I think that's the whole point we're trying to make, right?
Right, because at the end of the day, the animal, we want them to be comfortable. We don't want them to have to suffer through something unnecessarily.
Yeah, exactly. So basically, the message is don't be dogmatic either way. Don't
Right,
refuse
exactly.
when it's needed for acute, and don't reach for pharmaceuticals when the dog or cat really needs to they need to do is to stop eating inflammatory ingredients and get better movement, reduce stress, and so forth. Yeah.
It all goes back to that looking at that individual and what they need for that time and
Mm,
how to help them move forward.
mm.
So that brings me to, we hear a lot about integrative. What's that? I mean, what are we talking about there? Because we know what that is. We hear it, but it is definitely a newer term as far as making that out to the general public. So what do you think about it, Sunny?
Well, I happen to work with an integrative vet, and she does sell those traditional drugs, prescribes them, but she reads the patient too, and also the pet parent, like what are they available for? Because many times, I mean, she knows when I walk in the door, right? Is that, oh, I'm not going to be able to sell her Zenrelia, right? So not to like shame brand names out here, but we all know those drugs are, good and bad. But again, so an integrative vet, I guess, will do exactly what we talked about. They will assess the situation, and they are not opposed to using pharmaceuticals when needed if it's a really serious case. But for instance, when I go to my integrative vet, there might be a case where I did need antibiotics, and then she's like, here's some probiotics to feed as well, giving the rabies vaccine, which is the only vaccine I do now because of it's mandated by law. She's like, she gives me Tuya. So it's, a way to kind of integrate those two approaches. And at the end of the day, I think it's really about doing the best we can for that specific animal that comes in. But, that's kind of how I look at it. And it's, the best of both worlds, because we are not thinking that one camp is better than the other, but there are misuses of both approaches, right? I think that's what we're
Definitely.
trying to communicate here. So what in your experience, what do you think about the integrative approach?
I think like just what you said, it's really the best of both worlds. And it's truly, to me, it feels like the most holistic approach that you can take because when we say no to an entire um area of medicine, I mean, there's good and bad with Western medicine. A lot of the bad really isn't the medicine itself. It's kind of the way the industry is run, right? It's not necessarily Western medicine is bad. It's just kind of the complex of it is not great. So if you can kind of take that part out and take the parts of it that are helpful and integrate that into a holistic lifestyle, it just seems like the possibilities of health are endless, right? Like you can really help get through crisis and then you can also help maintain health through a holistic lifestyle. So, and to your point about if we do have to give something like an antibiotic or pharmaceutical pain medication, supporting that animal with something else, like
Mm,
milk or something to help the liver. There's things that we can do to kind of help clean up those extra side effects that might be laid behind.
yeah. And I think, what does this conversation, how is it relevant to practitioners who listen? Like, how would you talk to a client who's maybe in either extreme camp, right? Like, there are ways to have discussions like we're having now about the positivity of each. Like, for instance, I have a client now who is very holistic minded, open to all kinds of different approaches, TCVM, what have you. But she has a dog that had Lyme disease when it was a little puppy, and now she's like not going to not give them flea and tick. So am I going to say, I'm not going to work with you? That's terrible. I'm not going to shame them for that. I'm going to say, well, there's a real chance. I mean, we live in the Northeast. Ticks are here year round. I even saw ticks, on dogs, a couple of weeks ago when there was still snow on the ground. So I'm not going to scare them or shame them for doing that, but I'm going to say, what can we do then to help detox the body from this? And that's something they could be open to, right? So
Right.
we have to also, my whole point of bringing this up is we have to be flexible and deal with the patient in front of us. Some are more, maybe need more of this than that, and just be really treating the patient in front of us, as we say so often in holistic medicine, right? And so, if that does require some Western meds or pharmaceuticals, so be it, right? But we do know how to support the body and not just beat it down with those rough, harsh drugs.
Right. No, that's a really good point because I mean there are financial constraints, there's time constraints,
Yeah.
there's like you said, some people are really impatient and need to see something right away. So
Mm.
being open-minded is going to we really just want to empower them, right? We're not
Mhm.
making these decisions for them. And I think that as a practitioner, I see that sometimes where it's the practitioner feels like, my way or the highway. And that's not really, I don't feel like that is our place. I feel like our place is to kind of bring all this information together and say, this is what I know. This
Yeah.
is the stuff that I think would help. This is why. And then if they don't feel comfortable with it, they being the client, walk through that with them. See
Right.
what they are comfortable with and really compromising because at the end we want to help support that animal. And if you give something that is unrealistic to that person, they're not gonna do any of it, and then it's a
Yeah.
disservice to them, to you, and especially to that animal, so it's about meeting in the middle, and sometimes that means taking from a camp that you're not completely in love with, right? But you know enough about to say, "Okay, well, if we're gonna do this, I know these are the potential side effects, so let's do this as well."
Yeah, and I think at the end of the day, the animal benefits from both perspectives, right? I mean, that's what integrative really means. Back to our discussion of that, is using everything available and not limiting our toolbox to prove like ideological purity, right? I mean, we
Yeah.
have to stay open and curious and humble, and seeing what that particular animal needs. And that's not, we're not betraying holistic principle by recommending conventional intervention, and vice versa. Like holistic, as we talked about in the beginning, it means whole. It's like looking at the whole animal and using the wide range of tools that we're so blessed to have available today, because medicine have come very far. And if that does include a drug for acute crisis, that's still holistic, but it doesn't mean we reach for that. I would say 90% of the time we don't do it, because there's so much we can do with herbs and food therapy and all the amazing other modalities that we work with in the holistic space.
Yes, exactly.
So, what's the main thing, Melissa, you want people to take away from this, or what are we trying to convey here? Round it up.
Honestly, I think it's about doing things mindfully. Whatever
Mm.
you're choosing to do is really know um, what it is you're doing, why you're doing it. Is it something that needs to be long term? Is it something that should be short term? And then what is your backup? How are you going to get to that long term care if this is a short term medication? Know what you're going to do, know what your limits are, but do understand that closing off and putting blinders on to something may, not benefit the animal. And how about you?
Totally. Yeah, use the right tool for the right situation and be honest about what you can and can't do. Like you were saying, know your limits and be humble. So, yeah, this was a great discussion. And we want to hear from you, listeners. How do you navigate this balance in your practice? What's worked? What's been hard? What are you still struggling with? We want to, continue this discussion. I think it's a really important one. And stay tuned for next week when we're going to talk about the tension between vets and holistic practitioners and why it exists and what it costs our clients. Thank you so much for listening, and we'll see you next week.
Thank you.
Before we go, we want to remind you that the information shared on the whole pack is for educational purposes only and is not intended to replace veterinary medical advice, diagnosis, or treatment. Always consult with your veterinarian before making any changes to your pet's diet, supplements, or healthcare routine. Every animal is unique, and what works for one may not be appropriate for another. We're here to empower you with knowledge, but your vet is your partner in your pet's individual care.